have all the nurses gone. They're leaving hospitals in droves, and that may mean that next time you're in the hospital, there may not be a nurse to answer your call. Good evening. I'm Dr. Timothy Johnson, and this is Nightline. Long hours, limited pay, and high stress have combined to create a critical shortage of trained nurses. We'll look at what's driving nurses out, what can be done to recruit new talent, and how to relieve the pressures on nurses who are still at patients' bedsides.
This is ABC News Nightline. Substituting for Ted Koppel and reporting from New York, ABC News medical editor Dr. Timothy Johnson.
It is easy to turn the nursing crisis into a matter of numbers, but numbers are distant and abstract. In many places, the nursing crisis is now. It means that your hospital has to shut down some of its floors. It means that you will not get the comforting touch you want or need next time you are in the hospital. And most critically, it may mean your life will be in jeopardy if you are really sick the next time you go to the hospital. And as ABC correspondent Gail Harris points out, for the nurse, there are many possible faces to the current crisis.
Sir, take a deep breath for me.
I did not see it as a problem. I used it to relax.
Okay, sweetheart, just turn me over your side.
By the time a nurse is using here, it's not high is not what the nurse is after. It's more relief, it's more escape.
They are the unsung heroes of modern medicine. It is nurses who are there to hold the hands, take the temperatures, and provide the first and often most important link between patient and doctor. With stressful jobs and ready access to medication, perhaps it isn't surprising that a growing number of nurses have problems with drugs or alcohol or both.
What do you do for a high after you have either saved or lost 6 people in an emergency room in 8 hours? You got the picture?
Nurses with drug and alcohol problems may grab our attention, but they're only one piece of a larger puzzle of nurse burnout caused by high stress, low pay, and unpredictable hours. In fact, one recent survey by the D.C. Hospital Council showed that in the greater Washington area, a hospital maintenance worker earns more than a hospital staff nurse, and area bus drivers earn $6,000 more per year.
I feel we're caught in the middle because we need to control costs. Obviously, there's a lot of criticism of hospitals and waste and whatever, and the high cost of health care. But if you control the costs, you also control the salaries, and you can't give what you don't have.
Nurses complain not so much about the starting pay, which in the low $20,000 range is slightly better than for teachers and paralegals, but that there is little room for growth. After 10 to 15 years, no matter how good a job a nurse is doing, no matter how hard he or she works, a nurse's top salary remains in the mid to upper 20s. The result of widespread job dissatisfaction is a nationwide nursing shortage that has doubled within the past year, forcing hospitals in at least 7 states and the District of Columbia to turn away patients, postpone surgery, or shut down entire wards. And the patients in hospitals these days require more care than ever before.
We no longer have patients coming in that are just having tests or they're up and walking around, can take care of themselves. They really are much sicker. The acuity is what we say. The acuity is much higher than it was in the past. Nurses used to have a break from that. They really don't anymore.
I don't like the word burnout, but it's draining. You know, it takes a lot of energy, takes a lot out of you emotionally.
And physically, too. A nurse can't go home until a replacement arrives. With 225,000 nursing jobs remaining unfilled across the country, finding that replacement is much more difficult today than it used to be.
There's something else you can do. I mean, you can't leave the patients. They need the care. You can't leave them.
So no matter how tired you are,
you work.
Hospitals like Suburban Community in Bethesda, Maryland, are having to offer $500 finder's fees to attract qualified nurses, or simply more money to fill the vacancies from intensive care to the operating room.
We find them basically from agencies. Nurses are going to work for agencies because of the higher salaries and the ability to dictate their own hours and days.
That may be good for the hospital staff count, but not necessarily for the regular staff, who often have to interrupt their own work to show agency nurses the ropes. Other hospitals are recruiting from abroad, primarily the Philippines. But that's no easy answer either.
Sometimes they're not licensed to practice the same kind of nursing in your hospital that they are abroad. Sometimes there are language problems.
The obvious solution would seem to be training more nurses, but the trend is in the opposite direction. The best and the brightest who once went into nursing now are going elsewhere. Women whose career options were once limited to nursing or teaching now have other opportunities at far greater salaries as doctors, lawyers, and business executives. In fact, the number of students enrolled in nursing programs dropped by 24,000 last year, and several schools that used to train nurses are shutting down. For now, it seems a vicious cycle. Stress leading to shortages, leading to more stress.
On extremely busy nights, when you end up staying over late, you don't get things finished, patients die. Sometimes you bring that home with you.
What really comes first? Is the burnout lead up to the addiction, or is the addiction in process already that's leading to the burnout? With the shortages currently, what we're walking into is a time bomb.
This is Gail Harris for Nightline.
When we return, we'll discuss the problem of nursing burnout and the shortage of nurses with Lucille Joel of the American Nurse Association and with medical economist and writer Harry Schwartz.
This is ABC News Nightline, brought to you by Ford.
Ford Motor Company's new 6-year, 60,000-mile powertrain warranty has a quality all its own. For the 7th year in a row, our cars and trucks have had fewer reported problems on average than any other vehicles designed and built in North America.
Not just when they were new, but thousands of miles down the road.
6 years, 60,000 miles.
With a warranty like that and a quality record like ours.
Whose car would you rather be driving?
At Ford, quality is job one.
I went to my dentist with the worst pain. He told me about a different medicine. It's in these little yellow pills, Nuprin. Works so well on that pain, no wonder it's great on my awful headaches.
Nuprin. It's not aspirin, not Tylenol. It's ibuprofen. So effective, 2 Nuprin stop headaches better than extra-strength Tylenol.
And Nuprin's gentler on my stomach than aspirin.
Nuprin. Little, yellow, different, better.
It even worked on my worst pain.
No sport has changed more over the past few years than tennis. It's more colorful, competitive, and controversial than ever. Tennis Magazine delivers all the action. Conflicts, the stars, the big matches, the new equipment, and the tips that can improve your game. Every month you'll meet today's and tomorrow's tennis greats on the court and off. And you'll get full coverage of the top matches, where, when, and who'll be playing. Tennis brings you the newest ideas and equipment. Rackets, stringing, shoes, what works and what doesn't. Masters of the game like Connors, Ashe, and Traber take you from baseline basics to advanced court strategy. You'll find the best spots for tennis vacations, tennis camps for the kids. Tennis Magazine. In my book, seated #1. Here's how to order.
Get a year of tennis for only $9.97, less than half the newsstand price. Call 800-228-6600. You'll also get our free booklet with tips to improve your game. Call 800-228-6600.
This week, when 2020 moves to Friday, Katharine Hepburn breaks her silence to Barbara Walters about her life and her secret love, Spencer Tracy. 2020 moves to Friday.
Joining us now from our bureau in Los Angeles is Dr. Lucille Joel, a professor of nursing at the Rutgers University School of Nursing and first vice president of the American Nurses Association. And in our New York studios is freelance medical writer Dr. Harry Schwartz, a medical economist who last month wrote a newspaper column entitled, quote, "This nurse shortage is largely contrived." Dr. Joel, since the opening piece did refer to the problem of drug addiction among nurses, I want to dispense with that with this one question. While we know that both doctors and nurses are at risk for this problem, is there in fact any connection between the current nursing crisis and shortage and an increased risk for addiction problems among nurses?
I would say that the draining practice situations that nurses are in, the shortages, the extended work hours, and the demands probably create a tendency to get into this stuff, as they do with anyone who's under pressure.
Okay, but nothing more or less than it would be for any other situation of pressure.
No, and organized nursing, the American Nurses Association is very aware of the problem, and through us they have been putting into place very effective programs to help nurses who find themselves in these types of problems.
All right, we want to focus primarily on the social and financial causes of the current nursing crisis. How would you characterize that crisis in brief form? What's causing it?
All right, very briefly, Tim, there is a crisis. It's going to continue unless we face it head on. It's a big consumer issue. The consumer is in jeopardy, being in the healthcare system without nurses taking care of them and acting as their advocates, integrating their care, and so on. We need more nurses today. We need better educated nurses. Nursing has opportunities today that were never dreamed of a generation ago. There are more positions. The hospital situation is only the tip of the iceberg. There are new and dramatically challenging positions in home health care, in community nursing, in school nursing, occupational nursing, and so on. However, despite all the opportunity that exists, we find fewer and fewer people being attracted into nursing as a career, and therefore that's what creates the
And the
shortage.
place where it really hits is in the hospital.
Of course it hits in the hospital, because in the hospital people have the least ability to watch out for themselves and protect themselves, and nurses have been those protectors.
All right.
But the job opportunities are dramatically beautiful, but young people are not selecting nursing.
Dr. Schwartz, in your very provocative column a few weeks ago, you charged that this nursing crisis and shortage in the hospital scene has been, quote, if I recall the article, engineered by nursing leadership. What do you mean by that?
Well, let me say that in 400 words, which was all I had, I couldn't give a good analysis or detailed analysis. Let me just make a couple of points. First of all, I don't see any nursing crisis. We're a nation that apparently believes we've got to run to crises. For 20 years, we're told about the doctor shortage or the doctor crisis. Now we get doctors coming out of our ears. There are individual hospitals that may have shortages, but the figures, which are really very important, and I was surprised you put them down earlier, sir, show that we have more nurses employed now than ever before in the history of the United States.
Do you challenge the figure that the shortage in hospital settings has jumped from about 5.6% to about 13% in the last year?
Let me put it this way. 2 registered nurses, who are both also people with higher degrees, wrote an analysis of the nursing situation which appeared in the New England Journal of Medicine, the issue of September 3rd last. And they both pointed out that it's a very curious thing and it's a very artificial thing. What people do is they count up how many nurses do the hospitals say they'd like to hire and how many do they have. And the conclusion they came to is that the hospitals are in such good positions now financially that they're hiring more nurses than they would have earlier, and that they're firing people like practical nurses, like nurses' aides. In other words, the real situation is much more complex than the propaganda of the American Nursing Association, which wants more money for its members. I don't blame them. But the real situation is much more complex than the nice, easy thing which your Gail Harris gave us a few minutes ago.
Dr. Joel, I presume you would like to challenge that analysis.
Yes, I'd love to challenge Dr. Schwartz. People are much sicker in hospitals today. To give you one example, in one large medical center, within 3 months after the initiation of the DRG system, the prospective pricing system for Medicare recipients several years ago, the acuity rate increased 25%. In other words, those are the hours of nursing care that a patient would consume in a day, increased 25%. Hospitals are being used much more judiciously. Technology has expanded. Floors in hospitals look like intensive care units. There is a need for twice as many nurses in hospitals as there were several years ago. There are projections that by the time the whole reimbursement situation sifts out, we're going to have a 300% increase in the volume of visits in home care, and I can go on and on. More nurses are needed, and in the past 3 years, we've had a 25% fall-off in recruitment. Now, Dr. Schwartz makes an issue out of organized nursing, lobbying for more educated nurses. I think it's
Yes, you're trying to cut down the supply. We used to have excellent nurses graduating from 2-year schools, and you people have virtually ended the existence of those schools.
Nurses need to know what they're doing, and there's no way you can cope with the current healthcare delivery system with the education that you received 10, 20 years ago, or that I received in 1958.
Yes, but a young woman or a young man could get 2 years of nursing training today and be qualified, except you people are trying to end all that. You want to increase the shortage. You don't want to diminish it.
All right. We're going to have to interrupt here because we do have to take a break in this program, unfortunately. When we do come back, we're going to be joined in our discussion by someone who wears several hats. A nurse herself, Connie Curran of the American Hospital Association, will represent also that point of view. We'll be back in a minute.
What do you think of Jensen's report? Looks terrific. I thought so, too. It's nice to see our computer system is finally earning its keep. I wish that were true. What do you mean?
Marketing isn't using our system anymore.
And how do they do this?
They did it on their own system. The one they got a month ago.
They put this together in a month?
Well, not quite, Frank. They did it in a week.
You don't have to be a genius to know the more these kids like the taste of oatmeal, the more they're going to eat. So Quaker Fruit and Cream Instant Oatmeal comes in 4 real good flavors. Who ordered the peaches and cream?
I did.
And the bananas?
Me.
That means you get the...
Strawberries.
You're a strawberry. Quaker Fruit and Cream Instant Oatmeal. It's the right thing to do and a lot of tasty ways to do it.
Era Plus takes on today's toughest laundry problem. Your children. They're why you need the protein power of Era Plus. Nothing cleans every stain, but watch Era cut clean through muddy dirt and tough protein stains like grape juice and tomato soup. See, protein gets out protein. Think you've got problems? They're child's play for Era Plus. Protein power to cut clean through.
As the 1988s are being delivered at Valley Motors in New Kensington, we're making tremendous deals on our great inventory of 87 models. Hurry in for the greatest savings of the year on Ford, Chrysler, Plymouth, and Dodge. Plus, our business manager will help you keep your monthly payment as low as possible. Exciting savings, great selection, and a commitment to customer service are waiting for you. So don't wait. Hurry to the 87-88 model changeover sale going on now at Valley Motors, 100 Greensburg Road, New Kensington.
John Philip Webster, age 32 years. Looks older, acts older. John Philip Webster, 1 year later. Looks younger, feels younger, more confident. The reason? The new image step-by-step method. Possibly the most advanced hair replacement method ever devised. Definitely the most natural. Call now for your free brochure.
ABC News shows what the Constitution is about as no one else can. 12 of America's most distinguished actors and actresses bring history to life. The Blessings of Liberty, Wednesday.
The Senate confirmation hearings begin Tuesday for Robert Bork.
Tomorrow, why this Supreme Court nominee is so controversial.
And the Reverend Pat Robertson.
Tomorrow on Good Morning America.
Joining us now in our Los Angeles bureau is Dr. Connie Curran, the executive director of the American Organization of Nurse Executives. Dr. Curran also represents the hospital industry as a vice president of the American Hospital Association. Dr. Curran, as a hospital association representative, is there or is there not a shortage of nursing in hospitals?
There's a dreadful shortage of nursing in hospitals. We have about 150,000 vacant positions in American hospitals alone. They happen to be in every clinical area, all the way from critical care to the operating room to the OB unit. And they're not only staff nurses, they're also head nurses and nurse administrators. It's a very bad shortage indeed.
All right, right on that point, Dr. Schwartz. If there are 150,000 vacancies, if hospitals are advertising, going to the Philippines and Ireland for nurses, how do you say there's no shortage?
Look, we've got a nation of 250 million people spread over a huge area of the world. Of course you can find hospitals which want nurses. No question
Now,
about
what do
that.
you want?
But
Do they need them?
Well, what does need mean? If they were willing to hire more nurses' aides, more licensed practical nurses, they can get a lot of these jobs done. Let's face it, that most of what people expect of a nurse is they be nice and they handle the bedpan properly.
Let's stop right on that point. Dr. Curran, is that in fact a legitimate question, that it's maybe not more RNs that are needed, but other kinds of ancillary help? Would that be the way to solve the problem?
I think it's a legitimate question. I don't think it's a legitimate answer, unfortunately. Patients today are terribly ill, and certainly hospitals, if they could use a less skilled worker, would. That's not the issue. The issue is that patients are in hospitals for shorter periods of time, so they need more nursing care. The technology is more sophisticated than ever. The ethical decisions are unending. And certainly the need for registered nurses is very, very real.
There's a very interesting point over here from both of our nurse speakers. And by the way, Dr. Curran, I understand that your organization of nurses is talking about leaving the American Hospital Association. So I'm not entirely sure as to how much you speak for the American Hospital Association.
Wait a minute. Well, you can't throw that out without an answer. What does that mean? Dr. Curran, is that true, or what is... Huh?
No, I am a I certainly can't speak for the American Hospital Association. I'm the vice president for healthcare management and patient services, which is a lot more than
but you're also the president, we were told a few minutes ago, of the Association of Nurse Executives. And according to the New England Journal of Medicine, that association is talking out loud about leaving the American Hospital Association.
All right, on that specific point, is that true? And so what does that mean? Dr. Curran?
That issue is really very peripheral to the issue of the nursing shortage that we're here to discuss.
Yes, let's not get bogged down. I'm right. Okay.
All right, but let's not get bogged down.
Could we get back to the subject of use of less prepared people in hospitals today?
Speak to it, please.
All right, I would like to. Registered nurses are very multi-purpose workers and have been shown to be your best buy regardless. Lesser prepared
Well, that's what the spokesman of the licensed practical nurses also say. Sorry, we don't have a representative of them on this program.
Well, maybe we should, but we don't. And lesser prepared workers have to be supervised in everything they do. When you have a lesser prepared worker, you're draining off some of the time of a more educated, autonomous worker to watch that lesser prepared worker.
Are we, in fact, possibly talking about a need for increases at all levels?
I think that we are, Dr. Johnson. I think that just as the qualifications of the medical staff have increased over time and the qualifications of pharmacists and physical therapists, the qualifications of nurses have also increased. I'd like to make one other point on the statistics that Dr. Schwartz was quoting before. They really are grossly inaccurate. The number of graduates of nursing programs has gone up steadily. The applications are down for the last 3 years, that's true. But the number of associate degree grads, which is the group he particularly referred to,
the two-year
has gone up, the two-year people has gone up steadily. And in fact, they're now over 50% of all the nurses who graduate from school.
And what about the 3-year graduates?
The 3-year graduates are at about 15%.
Way down, haven't they?
But she is right about the 2-year program. They're going up.
I am.
All right.
Dr. Schwartz, I think you have to recognize that hospital schools do not provide the academic credentials and the career mobility for people that...
Yes, but we're talking about a nurse shortage and not about providing career mobility so anybody can do what they want to. Let's talk about the subject.
A person who selects a field of work to invest their life in wants to see that there is some future in that field. It's the same perspective as with economics. Nurses start in the field at a salary of about $19,000. They top off about $7,000 later. People don't see an economic future in the field. They don't see status and prestige in the field.
Well, we do have to take a break at this point. When we come back, I want to ask each of you how much of the problem is money and how much is professional status. And we'll ask you all that question in just a minute.
ABC's Olympic Diary is brought to you by Miller Brewing Company. Alpine skiing became an Olympic sport in 1936, featuring a combined downhill slalom event. Now, mind you, there were no chairlifts, and technique was not exactly slick, but as the skiers raced, so did the hearts of the spectators.
I am master of ancient art of karate, kung fu, and the Chinese chopper. But the one about the socializing... I always reach for a cold Miller Lite. Light tastes great. Light less filling, too. Hey, anybody want the pepperoni?
Ancient proverb, only one light beer, Miller Lite.
Germany won both the men's and women's alpine ski events. A great satisfaction for the Third Reich.
Manage. To handle or direct with skill. Rockwell International Management stimulates the work of its 120,000 employees, 1 in 6 a scientist or engineer. Their elegant solutions to customer needs make Rockwell a world leader. Rockwell International. Managing high technology for global markets.
For those who've wondered what's in those storage boxes, Rubbermaid makes it perfectly clear. You can buy something less than Rubbermaid, but then you won't get something made like Rubbermaid. Don't you wish everything was made like Rubbermaid?
In 1973, a small bar served the first light beer. The response was unanimous.
Tastes great.
Here was a beer with its own special brewing process.
Less filling.
It's brewed to be light with only the finest quality ingredients.
Tastes great. It's less filling.
Today there are lots of lights around, but none are brewed like Miller Lite, and none can match the taste.
Tastes great!
For great taste, there's only one light beer, Miller Lite.
If you don't buy your next car from Yenko Honda, you'll probably pay too much and get too little. Period. Yenko Honda, Route 19, South Hills.
Polo is for everyone at D.T. Watson. Join the fast and furious fun as Western Pennsylvania's only 2 polo teams play for the benefit of the D.T. Watson Rehabilitation Hospital. Gates open at noon and the fun begins at 2 on September 20th on the hospital grounds in Swickley, and includes an afternoon of activities for the whole family.
Free catalog, box 37,000, Washington, D.C., 20013.
Careers. Continuing our discussion now with Dr. Harry Schwartz in New York and with Dr. Lucille Joel and Dr. Connie Curran in Los Angeles. Dr. Curran, how much of the problem is money, how much is professional status and working conditions?
I think those are both important elements of the problem. Certainly, nurses don't get paid what they're worth. I think if you've ever been a patient, you know it's very hard to put a value on what it means to have a nurse there when you need one. At the other point in time, there are many nurses in the country who earn in excess of $100,000. So there are career potentials for nurses who get in there and who work hard at it. At the other point in time, status is a problem. And women today want more status, and often they don't see nursing as providing that status. Okay. I think it's our job to let them know that many nurses have high status jobs and to know the real satisfaction of taking care of people.
Dr. Schwartz, you're an economist. Should we pay nurses more, and if so, how?
Well, if the free market works out that way, if the hospitals need more nurses and more money will help solve it, by all means, they ought to pay it. But let me point out that the real problem is the leaders of American nursing want nurses to become doctors. There's a very much of an envy of the doctors and a desire to overthrow them. And the point is that there are now 20,000 young women in the medical schools of the United States. And I agree with my doctor friends, my medical doctor friends, since I'm not a medical doctor, that if nurses want to become doctors, they ought to go to medical school.
Okay, Dr. Joel, that's a charge we often hear. Speak to it.
Yes, Tim. Medicine and nursing are complementary professions. I don't know any nurses that want to become doctors. I think what we have to realize is that there are activities that can be addressed by either profession, and the person who can do them in the most cost-efficient way should do those types of things. And I think Dr. Schwartz may be referring to things such as physical examinations and so on. Whoever can do those things most cost-efficiently should do them. But I want to get back to the economics for a minute. The American Nurses Association represents 130,000 nurses through their constituent states in collective bargaining. We have an investment in the workplace. We fought hard for salary equity. There isn't salary equity. After World War II, nurses earned 32% of what physicians earned. Currently, we earn 17% when compared with a physician's salary.
We do have to stop at this point. Fascinating discussion, all kinds of issues. We've got to do it again sometime. I thank you all for joining us. Tomorrow, the Senate Judiciary Committee opens hearings on the nomination of federal Judge Robert Bork to the Supreme Court. ABC News live coverage of the Bork confirmation hearings will begin at 2 p.m. Eastern Time. That is our report for tonight. I'm Dr. Timothy Johnson in New York. For all of us here at ABC News, good night.
This has been Nightline. Nightline is a presentation of ABC News.